Welcome, everyone. Good, good evening. Uh, we are not starting yet because we are waiting for everybody to start joining. It's a significant amount. So, okay. Good evening, everyone. If we are there, please can we signify by answering, please? If you can hear my voice. Good evening, everyone.
Good evening.
So, my name is Olaogun Victor, aka Vado Bams, and I'll be your host for today. I'm a 600 level medical student, and I'm sure we are wondering why we've not started. We're just trying to admit more people into this meeting. Because, so, by 4:05, we would start. 4:05, we would start. Thank you very much. So, um, good evening, everyone, once again. My name is Olaogun Victor, and I'm the academic director of Going University, the clinical wing, and I'll be the host for this meeting. So, it's 4:06 already, and we have to start. Um, Thank you very much. Thank you, everyone, for joining. We can still see people actually joining. Thank you very much. So, what we'll be doing today is the theme of our program is BUTH Today, Canada Tomorrow. And, this many of us actually want to leave the country once this is over because it doesn't seem like things are getting better. So, and that was where this particular reasoning came from, that why not help everyone to know about this international examination, how to go about it before we are done with school, because apparently it is better you start preparing now before you graduate and it starts to seem, not too late, but we get very busy once you graduate. So, because of this, I was able to reach out to two of our alumni, and apparently they are my predecessors. They are the academic directors, and they've agreed to speak to us about how to go about this international examination. Can we all chorus welcome to both of them, please? Are we there?
Yes, we are.
Okay. Thank you
Welcome.
very much.
Welcome.
Thank you. So,
You're welcome.
Welcome, guys.
Welcome.
okay. So I'll be introducing our our speakers for today. The first speaker being Dr. Osinusi Ifeoluwa, is the UK-based doctor, a plug, then UK MLA pathway mentor. You're welcome, sir. You're welcome, Dr. Osinusi.
Hi, Victor. Just call me Ife. You don't need to
Okay,
put doctor there.
okay,
Just call me Ife. It's fine.
okay. Then, thank you very much. Then our second speaker, Dr. Motunrayo Adeleye. She's also going to be speaking to us about this. She's an internal medicine resident. You're welcome in our midst, and thank you very much for agreeing to speak with us. So we'll start now, since it's 4:09. Dr. Osinusi will be the first speaker, and he has about 20 to 25 minutes to speak. And after he speaks, there will be sessions for questions for about 10 minutes. And I hope all of us will be preparing our questions. Thank you very much. So, Dr. Osinusi, the floor is yours.
Hi. I don't know if you guys can see my screen and my round head. Let me know if you can see my screen, please, and then also my round head. Can you see both of them? Hello. Hello.
Yes, we can see it. Yes.
You can see it, sir. Yes, you
Okay.
can see it,
So
sir.
my screen and my round head, both of them. Can we see both?
Yes, sir.
Yes, sir.
Perfect. All right. So my name is Ife. Just a regular guy. A couple of you may know me. A couple of you probably don't know who I am and asking where did this guy come from. Finished from BUTH, was the academic director, I think 2020, 2021. Then before I finished, I was a bit indecisive, Should I travel out of the country? Should I stay in the country? A couple of my friends already had the idea that I'll probably leave the country. I'll be the first person in my set to run away. But to be honest, I wasn't decided, right? Because you have to have a pathway, you have to have a plan with life. So I wasn't fully decided on what to do. It's kind of like my house job. How I told everybody I was never coming to BUTH, but I ended up in BUTH. So currently I'm working in the UK. I'm in a residency program, ST1, and it's been good, to be honest. It's been quite good. And I will just speak to you guys briefly about the UK pathway before my colleague will speak to you guys about the more luxurious pathway, which is the US. So let's just begin. So the UK pathway. Now, I think this is one of the, I won't say easiest pathway, but this is the pathway that a lot of doctors try to go through, because compared to other pathways, the US pathway, Australia, Canada, it's a bit cheap. I mean, it's cheaper than both of them financially. And even the rigors of the exam is not as difficult as the US pathway, Canada pathway, Australia pathway. But still it's a bit difficult and it is still financially intensive. Now, what is this pathway? It's a pathway where you are granted license to work in the UK, because you in the UK as a medical doctor without a license. So you are granted license to work in the UK, and after that, you get a job. Now, there are different types of jobs you can get as a doctor in the UK. Different types. But before I talk about the jobs and a different job description, because you hear people saying things like, sorry, things like SHO, things like FY1, FY2, ST, CT, Reg, clinical fellow, senior clinical fellow, junior clinical fellow, teaching fellow, etc., etc., etc. Before we talk about that, let's talk about the exam. So I was telling a friend of mine, I think still in BUTH, that it's a lot easier for you guys now, to be honest, because you have all the information out there. So you can start planning right from 200 level, 300 level, if you want to leave, if that is your plan. And it's good to leave early. While I was doing house job, one of our consultants told me that if you want to leave early. Don't wait till you're a bit old and then you have your children, you're married, you have family, and then you have to consider all of that. If you want to leave early, right? So it's good for you to start planning now. So to get into the UK, you have to write 2 exams. As a matter of fact, 3 exams, to be honest. During my time, it was called PLAB exams, professional linguistic assessments, I think based exam or something. And now it's called the UKMLA, United Kingdom Medical Licensing Assessment exam. And it comes in 2 parts, part 1 and part 2. Before you are qualified to write the part 1, you have to have your IELTS. It's not on this slide. I think International English Language Test, something like that. And you have to score at least 7.0 in all your categories and an average of 7.5 to be qualified to write PLAB 1 or the first exam. So it's a simple English exam, but it's not very simple, because I've seen people write this exam multiple times, 2-3 times, and you have to score at least 7 in all the categories and then an average of 7.5. So it makes that a little bit difficult for you. Now, you write the exam, it lasts you for about 2 years. Before 2020, I think before COVID, so you have to write your PLAB 1 and PLAB 2 the moment within 2 years after passing your IELTS, right? If not, you won't be granted a license, even if you pass your PLAB 2. And when COVID came, they had a backlog of people trying to write these exams, because a lot of centers closed, and they extended time to 3 years, but now it's going back to 2 years. So IELTS is the rate limiting step. If you're in your final year and you want to go through this pathway, you want to work in the UK, I would advise that you could write your IELTS in your final year. I know a couple of people, two of my seniors then in medical school. A lady, she wrote her IELTS when she was preparing for her final exam. I think before her final exam, final MB. And she didn't serve after her job. She carried along and she left. Another guy too, IELTS immediately after what do you call that thing? Immediately after graduating, wrote PLAB 1, wrote PLAB 2 during house job and left immediately after house job. Right. So it depends on what you want to do or how fast you want to move. So the PLAB 1 exam or UKMLA exam is basically a theory-based exam, it's a computer-based exam. So you'll be assessed on clinical scenarios. You're assessed on 3 categories. First category is your ability to manage. Second category is your ability to make a diagnosis. And the last category is your ability to, or rather, your knowledge base. So they could be asking you things like, what is the arterial supply of this, or blah, 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 stuff like that. But most of the questions are clinical-based questions. So you have to, it's not just about having stuff, because the stuff that you would use for this exam is a bit different from what we learn in medical school, right? How long does it take to prepare for the exam? It depends. So prior to now, I think I used to, on my spare time, I used to teach PLAB 1, right? Just help people to pass the exam free, right? And I've seen people write the exam within 4 weeks, some 6 weeks and pass, some 3 months. So it depends on you and depends on how fast you read and how much time you have in your hand. Now, PLAB 2 is a little bit different because it's a clinical exam. So they test the PLAB 1 and PLAB 2 test your knowledge base and test your ability to communicate. So PLAB 1 exam, like I mentioned, is just use a CBT exam. No, some center CBT, some paper based, 180 questions within 3 hours. You've single best, more or less, right? The pass mark is determined by the average. So usually it's around 111, 112, 113, about 60%, right? So if you score less than that, you have to resit the exam. Now, PLAB 2 is a different exam totally. It's OSCE. You have 16 stations. Each station is about 8 minutes. So you go inside, you meet a patient, or you have a mannequin there, or you have a student to teach, and then you solve the task you are asked to do in that category. Yeah, or in that particular station. 16 stations essentially. It's not as difficult, to be honest, but then again, it's a clinical exam. So what makes it very, very demanding or tasking is the fact that you spend a lot of money in this exam, a whole lot of money, because for PLAB 1 is about £250, that's about 500k, and PLAB 2 is about £1,000. And then you have to pay for flights, you have to pay for visa, accommodation, academy. It's quite a lot. So in the exam, I mean, when I was writing my exam, I think the first 5-6 stations were very terrible. And then my last station, I said I must collect my money in this station. And during the exam, you have break in between. So people usually make jokes that in your station where you have breaks there, they give you like tea and biscuits. So people will like put the biscuit inside their pockets. Anyways, so it's quite expensive, right? And it's a clinical exam. Now, when you pass your exam and you've gotten your registration, you've gotten your license, you've done your registration, you've gotten your license to practice in the UK, there are different jobs you can apply to. Now, you can only write PLAB 1 when you have graduated from medical school, when you have a medical degree. You don't need to have worked. So the moment you graduate from medical school, you are eligible to write PLAB 1 and PLAB 2. Now you see things like FY1, FY2, SHO, ST, CT, Reg, clinical fellow, teaching fellow. There are different job descriptions for different grades. Now FY1 is foundation year 1. You are a house officer. So the housemanship in the UK is about 2 years, FY1 and FY2. After your FY1, you'll be granted full registration and then you can work as an FY2. Now, if you are hell bent on living in the country and not even practicing one practicing even up to a month in the country, you can apply for FY1 position. So the moment you finish your medical school, you can write your PLAB 1, write your PLAB 2 within a matter of 6 months. You finish, you apply for FY1 positions, and then you start your career from the ground in the UK. FY2 positions are usually two types. So you have your standalone FY2. Yeah, the slide isn't moving. Don't worry, I didn't make too many slides. I just made like 4 or 5 slides. So try to listen. And if you cannot hear me clearly, please let me know. I'm using headphones. Very important, so that I'm not just speaking and speaking to, you know. Yeah. So FY1, FY2. Now the FY2 foundation year 2, for you to apply to that, you have to have a full registration. So after your housemanship, if you don't want to serve, you can apply for FY2 roles. Now, FY2 could come as a standalone program. So it's quite difficult to get standalone FY2. It's quite difficult to get. Now, if you have worked 2 years in the country, you can apply for SHO positions, right, which is senior house officer. So it's like you're like a medical officer in whichever department. They usually call them FY3 or FY4, depending on how many years of experience you have. So you work like a medical officer in the different departments. And at the end of the day, you probably have the same job description as people who are actually doing residency in those departments. Then ST and CT. So ST is specialty training and CT is core training. So ST basically means that you are in a specialty. So let me use the next slide to explain what I'm about to explain now. So for training in the UK, I get this question a lot. Can I do surgery? Can I do internal medicine? Can I do PET? Can I do general practice? Can I do histopaths? Whatever. You can do whatever specialty you want to do. It's difficult to enter some specialties, obviously. It's difficult to get into any specialty now, to be honest, because the pool is very saturated, right? But you can do whatever you want to do. Victor, please let me know when I have 10 minutes more, when I have 5 minutes more.
Okay, sorry, if we are following 20 minutes, you have 5 minutes more, but we extend it to 25, so you have 10.
5 minutes.
But 10,
Victor, 10
we
minutes.
extend.
Because I still have a couple of things to say, but I'll try and run quickly. Yeah, so first of all, you can do whatever you want to do. Whatever you want to do, you can do it. If you want to do neurosurgery, I know someone, not personally, but I know someone that got into neurosurgery this same round that I got into my own training, go into neurosurgery. So whatever you want to do, you can do it. Right. Now there are 2 types of training programs. You have the run through and you have the uncoupled. Right. Let me be sure I got this correct. Yes. Okay, I need to put IMT here. Now, so there's some training programs that once you get inside, you have 6, 7, 8 years and you run it through. So what it means that you start your program, you know you're going to finish in the next 8, 9 years, right? And these are the specialties. So for cardiothoracic, I don't know how long it takes a long time. Radiology too takes a long time. General practice is 3 years. I think histopath is 6 years. Neuro is like 8 years. Obs and gynae is like 6 to 7 years. Ophthalmology is like 6 years. PEDS is like 6 years. Public health, I don't know how long. I think it's like 4 years. Yeah, so those trainings, you get into it and then you finish it within the stipulated amount of years. Now, the ones that are uncoupled are a little bit different. So they have this system that, especially for internal medicine, I think is the most popular uncoupled specialty, and it's not here. So you get into the specialty, you start as an IMT, internal medicine trainee, right? You spend 3 years in that role, and afterwards you apply for higher specialty. Within those 3 years, you are seen as a core trainee. You're not a specialty trainee. Now, after you're done with 3 years, let me see if I can. Good. I'm right on, so it makes more sense. Where's the pen here? Good. So if you want to do internal medicine, for example, you start off. So this is internal medicine. You start off as an IMT, and you spend 3 years. In this case, you are seen as a core trainee, not a specialty trainee doctor. Same thing with surgery. If you want to do surgery, you start in with core surgical trainee, which is 3 years. And afterwards, you then apply for registrar position. And then you go into a particular specialty. So you could apply for internal medicine, you could apply into gastroenterology, you could apply into whatever you want to apply into. For surgery, you could apply into general surgery, plastics, all of that, all of that, all of that. So all these specialties that you are seeing here, you have to go start off and spend at least about 3 years in a core training position before you can then apply properly into the specialties. I know it may not make sense, but I'm willing to answer as many questions as I can within the short time that have been allocated. Yeah. Now, I think we've talked about the costs. Totally, I would say you may need up to about 4M, 5M for the whole thing, but you don't need to have it at once. So you could start little by little. Start with your IELTS, then PLAB 1, then PLAB 2. And once everything your PLAB 2, you're good to go. And then you begin to apply for jobs. Yeah, follow your heart and trust God. So, Victor, how many more minutes do I have, please?
You have about 7 more minutes.
I still have time.
Yes,
Good.
you still have time.
Good. So let me talk about this thing because I think this is probably the most important aspects of whatever I'm saying today. Follow your heart and trust God. Now, I know a couple, at least I believe that most people here are medical students. Maybe a few people here are doctors planning on moving to the UK. I will start by speaking to medical students. So, you're a medical student, please try to listen. And I believe this advice will really help you. Now, medical school is hard. It is very, very hard. I'm not even going to lie to you. It's hard. Don't allow anybody to tell you that it's easy. But to be honest, it is the moment you're going to have the most fun, right? Residency is something, it's insane. There are days I come back from work and I'm like, God, I have to go back the next day. I have to go back the next day, or I'm on call. I have to work weekends. People are traveling to Spain and Montenegro, and I'm seeing me, I'm in the hospital, right? But have as much fun as you can have. Now, what I mean by follow your heart and trust God, there's one thing you should understand when it comes to traveling. You have to trust God and allow God to direct your path. And apart from traveling, even in medical school, you see, people will tell you that it's your stuff that will take you through medical school. From my own experience, stuff is not enough. I know a lot of people that would probably see me and think that this guy has a lot of stuff. This guy is very stuffy. Bro, there was a particular MBA I almost ran mad because things were absolutely crazy for me then. Good 5 minutes. And I will tell you for a fact that if you hold God, if you hold Jesus very close, your journey will be very smooth. That I can assure you. Right? Because for those in clinical, especially if you're in the year where you write your PIS exam, you would understand what I'm saying. It's absolutely insane because you're going to do clinicals and then it depends on who you meet. It depends on the person's mood. There are a lot of factors and it's not just how much stuff you know. So please, I know there's somebody listening here today that needed to hear this. Hold Jesus very, very close and it will help you. And it's not just passing your exam and finishing and graduating as a medical doctor. That's just the beginning. You're going to write all these exams. PLAB 1, PLAB 2, MSRA. So to get into a part of this I didn't speak about, sorry, to get into some specialty training, there's an exam you're supposed to write called MSRA, multi-specialty recruitment assessment exam. So to get into general practice, which is family medicine, psychiatry, anesthesia, surgery, and a couple of other specialties, you have to write that exam. You have to score high. To write that exam and to score high, you have to pray. Right? PLAB 2, you have to pray. So it is a lot more profitable for you to start holding God now and allow Him to direct your path. Right? So please, if you want to take anything out of what I've said, all of this, you can browse it online. The PLAB 1, PLAB 2, the different specialties, you can check it online. It's not hard. But if you need to take something out of what I've said today, please take this. Hold Jesus very, very close. Because medical school can be crazy, it can be insane. And having somebody at your back can be the difference between you passing your MB, between you even traveling and leaving the country. Believe it or not, the exam I registered, this exam, yeah, that got me into the specialty that I'm currently in. I registered for that exam late, in quotes. So the deadline was 4 p.m. and I registered for that exam 4:57 p.m. Nigerian time. And the only reason I was able to register was because there was a difference between UK time and Nigerian time. I had already given up. And then I looked at the clock and it was still ticking. I still had about 3 minutes and I was able to register. I write the exam and pass. I get into training. So there are little moments like that you will see the hand of God. So please hold God very close. And I've always said this: if you have not been praying before and the first day you decide to pray is the day I write to your MB, God will listen. He will listen, He will listen, He will listen to you. So please pray and hold God as tight as you can. I believe my time is up. I believe I'll be able to say more with questions, with people's questions. So Victor, I know you're looking at the timer like, oh boy, finish quickly. But I think my time is up. Or how many more minutes do I have?
You have about 2 minutes actually. I'm not
2
rushing.
minutes. 2 minutes.
2 minutes.
Good. So once again. So let's just quickly talk about the MSRA exam. Now you can get into training directly from Nigeria, right, without working in the UK. It's not really advisable because having NHS experience is very, very valuable when you start work, because the system is absolutely different from what we have in Nigeria in most places. Some places have certain similarities, but a couple of places is a bit different. So if you have NHS experience, it really helps you when you start training or you start residency, but you can get a slot directly from your country. Now, the exam holds, I think, twice a year, right? You don't necessarily need to have completed the PLAB exams, but before you start work, you have to have your license. So if you're finished PLAB 1, you can write your MSRA exam, write PLAB 2, and then start training 3 months after writing PLAB 2, right? To get into whatever training, look up person specification. Very, very essential. You see the things you need to put in your portfolio, right? Teaching. I know a lot of people have distinctions in different specialties. It will count for you when you're applying for these roles or for these specialties. Try to do teaching, right? Try to do other things in medical school, at least as medical students. Try to get involved in research. It will actually help you when you're applying for these roles. So the exam is written twice a year, like I mentioned, different rounds. If you have further questions about that, you can probably ask. What again? I know somebody will ask about life in the UK. It's actually good, to be honest. At least you can buy what you want to buy. It's not like Sapa will almost wound you. It depends on where you're living, though. Because if you're living in like London, that one, I don't know how this is survivable. But then again, if you're staying in the north, it's a bit easier for you. And then, so some specialties. So before I finish, just to say this, if you're applying into family medicine, which is general practice, some places give what is called tests. So they will give you a large sum of money to stay there for about 3 years and do your program. It can be quite useful for you if you want to settle down and buy a house and all of that. So just to add that. I think my 2 minutes is up. So I think it's time for questions.
Yes, thank you very much, Dr. Osinusi. Thank you very
You're
much.
welcome.
Can we all say thank you to him, please, before we go into the question section, please?
Thank you.
Thank you,
Thank
sir.
Thank
you.
you.
Uh, he has taken it. He has taken a little out of our time. Thank you very much for taking our time, Dr. Osinusi. So this is how it's going to go. If we have questions, you are free to actually, unmute yourself and ask your question. So, how many of us will be taking the first 5 questions because of our time? So, how many of us? Some people have sent questions to me. Okay, we have people raising up their hand. Shewon, please, you can unmute yourself and ask your question.
Good evening. Yeah, good evening, Dr. Shinasi.
Good
Um,
evening. Oh, that's Sheung. Chief. That Sheung I know.
yes, yes.
Yes, so it's the
How are
Shewon
you?
I'm
How are you
fine,
doing now?
sir.
It's
Very
nice to
fine,
hear your
thank you.
voice.
Yes, I'll
Yeah,
still enter your DM, but I just want
no
to
problem. It's
ask.
open.
I just want to ask if you have specific times of the year that you hold the teaching sessions for PLAB, and what fee it goes for. Yeah, that's just what I want to ask.
Oh, I'm not. My knowledge is open to everyone. People that really know me know I like teaching. So there's a WhatsApp group that you could join. The My schedule is really messed up, so I try to teach when I have the opportunity. So maybe once a week or twice a week. So you could send me a DM if you're interested in joining those particular groups, and then we hold lectures maybe like once a week, and then teaching sessions. So we teach on different specialties: cardio, gastro, neuro, endo, all those other specialties. Yeah. So there's no particular time. It's just when I have time to teach, then I just open a meeting and start teaching. And there's no fee. It's open to everyone. It's a voluntary stuff, so you can join in if you want to.
Thank you very much.
You're welcome.
Okay, so thank you very much, Shewon. Lawal to raised up hand, but before we go to Lawal, I would want to take somebody sent me a question too, and the question goes thus: after writing PLAB 2, can you go straight into ST? Then she said you were talking about MSRA exam. Is that after PLAB 2 or before ST?
Okay, so good. ST. So I'm
And
an
that's
ST1.
one. Then the second question
Okay.
from the same person is, and those and this pathway, does it also apply to European countries?
Okay, European country. So I guess somebody's going to Spain. Yeah, that's
Yeah.
nice. Or Portugal. Okay. So what you need to get into specialty training is you need some years of experience in terms of, for example, now general practice. I think you need about 2 years, 1 year after your house job, right? So you can apply after your NYC in quotes, right, for specialty training. Now, to write the exam, MSR exam is an exam that sorry, my battery is low. To plug. This is one of the good things in traveling. I can allow my battery to run down and just connect it to my village people want to embarrass me today. No. Yeah. So that's one of the good things. I can allow my battery to run to 5%, 10%, and I'll just plug it. JJ. Anyways, what was I saying? Seems my stuff is skipping a little. Can you guys hear me? Can you hear me?
Yes, we
Can you
can.
hear me? You can hear me? Good. Good. Perfect. So I was saying that yeah, you can get into ST1 directly. There's something called person specification. So you read that, and then from that you then know what you need to get into training. For me, after Plab 2, I got into training directly. After writing Plab 2, 3 months, started training. So it depends on you, but probably I would advise that you probably get some NHS experience before you start training. But then again, you can start training directly and you can be happy doing it. So you can start training directly after Plab 2. Once you have the years of experience needed to start training, you can. So Plab 2 gives you your license. Or your license, you can apply for whatever position you are best suited for. So people even get into consultant roles from Nigeria as consultants. So they have the years of experience, they apply for senior roles, and then they're lucky they get into those roles. So do.
Okay, thank you very much.
You're
We
welcome.
Yeah. Any more question before we go to the next speaker? Does anybody have questions? If you're shy, you can send it to my DM or you can text me. You know. And yes, Dr. Osinusi, I wanted to let you know that we have light in Ogumoshe here too, so you can't
Ah,
so you can't do that with us 24/7 in boots.
ah, you people.
I beg.
He's
Ah,
lying, no, please. Oh.
Ah, why you
Stop.
lying?
Right. I beg go.
yeah. Me, I know what we went through in boots in terms of light trenches. Anyways, what was I even saying? What was I saying? What was I saying? So if you have more questions, right, you can send me a DM. Victor, you can give my number to anyone who wants to ask questions. Are there any more questions before?
Yes. Eniola says she has a question. Eniola, please, you can unmute yourself and ask your question. Thank you very much.
Good evening, Dr. Shinesi. Good evening, everyone. So, my question was, I wasn't so sure of I don't think I understood the MSRA thingy. So, if you wanted to do kids residency, for instance, just say, not me, but somebody, do you need to first write your MSRA, or you first go through the FY2 route, then you now apply for a maybe, I don't know, ST sport or something? I don't think I fully understood it. Thank you.
For pediatrics, I think you have to write MSRE. So the MSRE exam is kind of like USMLE in quotes, right? The exam is used by different specialties: surgery, medicine, family medicine, which is general practice. I think pediatrics, anesthesia, different specialties. Now, what that exam does is that you write the exam for some OMG2, for some specialties. If you score high enough, you get a job directly. Some, if you score high, you get an interview slot. It depends on how well you do in the interview. That determines if you get a job. For pediatrics, I think it uses that exam to get people to get interviews. So to get into pediatrics, I think you'd have to write MSRE. I'm not exactly sure, right? If you're not going to write MSRE, what you're going to do is you're going to apply to look at your portfolio. If your portfolio scores, there's a threshold. If it reaches the threshold, then you will be granted an interview. In the interview, it depends on how well you do. You'll be ranked against other applicants, right? And then you'll be given a rank. So depending on where you put, depending on where you want to apply to. So if you want to apply to a place like London or Manchester, which are big cities, you have to do very well in the interview to get ranked very high and then get those slots. So I think pediatrics uses MSRE, but I'm not exactly sure if they do. I think they do. I think. All right, so I'll speed up with the questions now. I don't know, Annie, did I answer your question?
Oh yes, thank you very much.
But I'll go back to you on the specifics. So I think we'll have to spend like 30 seconds on answering questions now, because so that's
Yeah, so we have one question in we have, aside from Plabable for Plab 1, what other resources do you suggest we need for preparing?
Plabable is enough, to be honest. I use Plabable all through for Plab 1. I think it's enough. I think it's a very good resource. Plab Keys also is a good resource. You can use Plab Keys. You can use Med Revision. But if you have Plabable, I think Plabable and Plab Gems, I think, because Plab Gems is part of Plabable, so that should be enough. But if you want to add more information, Plab Keys.
Okay, thank you. And we have another question. By 4:50, we would stop the question and answer session. Thank you very much. We'll continue probably after the whole thing. But she said you didn't answer the question of does this pathway also apply to European countries?
Oh, good. So for other European countries, you have to write the exam. For the UK, which I think consists of Northern Ireland, Wales, England, Scotland, I think your GMC license is what I've said applies to getting slots in those places. So when you're applying for residency, you see the list of places, all the different places. So you see different cities in Scotland, in Wales, in England, all of that. So you could apply to any of them. So it's still the same central pathway. But for, I think, Ireland, which I think is a country, to get used to all these terminologies, you have to, I think, write an exam, a different exam. I'm not sure if your GMC license guarantees you a slot, right, in terms of residency. So I think you have to write another exam to get a license to practice in those countries, and then for other European countries like Portugal, I think you have to write a different exam. England or UK is not under EU anymore, so I think you have to write a different exam. But I'm not exactly sure. But I think you have to write a different exam to practice in those countries. But I'm not exactly sure. But it really depends. I've not really googled it, because for Australia, if you have 1 year experience in the UK, you can apply for jobs in Australia. I think you may be able to apply for license in other countries once you have your GMC license, but I'm not exactly sure. I'm not sure. So apologies.
Okay, so are you okay? You're still speaking, okay?
No, I'm done. I'm done speaking. I'm done.
Okay, thank you very much. I think any other question that comes up will be answered later, maybe in your DM or through me. But they be really appreciate. Thank you very much for taking your time
Yeah,
to
welcome.
actually.
I think Lawal has a question. I'll
No,
just
no, no,
answer
no,
that
no,
and
no,
then
no. She
run
said
away. Oh,
she said it was a mistake, so she doesn't have a question.
okay, okay.
Yeah.
All
Thank you.
right. So,
Thank you very
uh,
much.
you're welcome. So you can give my number to anyone who wants to ask a question in my DM. It's
No
open.
problem. No problem.
All right.
They might have to pay for
Nice to
it.
speak to you guys. Hey.
Okay. Thank you very much. So can we all say thank you to him before I think he
Thank
has
you.
something. Thank you.
Thank you.
Thank you.
Thank you.
So now thank you very much. Now off on to our next speaker. Our next speaker he's also an alumni, Dr. Moturayo Adeleye, PGY1, internal medicine resident. Thank you very much. Thanks for agreeing to be on this platform with us and ready to educate us on this about the international exam. Thank you very much. So the floor is yours, ma. You can begin.
Hi.
So yes, sorry, you have about 20 to 25 minutes. Then have 10 to 15 minutes for questions.
I'll try to do my best. Hello everyone. Were you able to allow me to present yet? Because it's still not giving me the option to present. Okay.
So I'm working on sharing your slide. I was sent,
Okay,
I'm
because I
working
also
on.
sent it to him.
Yeah, I'll work on that.
1 second, please. Let me see. It's still not giving me the option yet. Anyway, we don't have time, so I'll probably just start. Hi, everyone. I am Muturaya Adeleye. I was a Bowen student. I was in Booth till 2022. And I just matched. I recently just started residency July of this year, so I'm an internal medicine resident. And I'm here to just give a perspective on the USMLE side of things. So first of all, USMLE, that's the United States Medical Licensing Exam. Dr. Osinusi alluded to the fact that, okay, let me see if I can share now. Sorry. I don't think I can. I'm sorry. I don't think I can. If you can share the slides, that's fine. I will just continue. I have the slides on my phone, so I'm just going to use that to talk to everyone. Or you could share the slides with them via WhatsApp or something if it's not possible, and then they can follow me like that. Anyway. Yeah, Dr. Osinusi alluded to the fact that it's the more, well, he said luxurious, but I would just say it's more resource intensive in the fact that it will cost you time, it will cost you money. For some people, it costs them their sanity, but that's just exaggerating. It's very doable. A lot of people have done it. I have done it. Many people before me have done it. So it's something that is very, I was going to get there. There's the potential for very high rewards is there with the USMLE. You put in all the work and then eventually it will pay off, especially for us that we're coming from a climate where we don't have to, get student loans to pay off, but to pay for medical education, the potential for rewards is extremely very high. So if you stick to it, you will be able to, get the benefits that, other people are able to reap from it. But so in my slides, I put the outline there, but I just wanted to start out with a disclaimer. Dr. Osinusi does club stuff on the side. I do not. I'm just somebody that has taken the exam, and these are my 2 cents. I'm just going to share with you guys what I experienced, what I think about it. I try to put a lot of facts in there, but some of the other things that I'm going to talk about in this presentation, I have my personal opinions. There's a lot of resources on the internet which you can use to get the facts and then get other people's opinions as well. So these are just my 2 cents. Well, most of it are facts, but then I added some of my 2 cents, and you can take from that what you want to take from it. But I try to make it relatable to most of us, at least having been a student, having passed through it. I know some of the things that y'all might be thinking, so I try to tailor some of the things I will discuss to that. Okay. So first off, just a general overview of the pathway to matching. I think the most important thing anybody that wants to go on the USMLE pathway is to make up your mind. Because it is very, very, like I said, it's very resource intensive. So you don't want to start and then in the middle of the road, you're like, okay, I can't do this. I'm looking for another way out. I think from the beginning, it's very important to make up your mind. That would also help you on the days where it feels like, oh my God, what's going on? Am I going to be able to, continue with this or whatever? The days when you're feeling down, the days when you're having to take many questions and it feels like you don't even know what you're doing, or the day you have to take your exams and it's like, what in the world is this? At least you've made up your mind from the beginning, and then like, this is the path that I'm taking and I'm sticking with it. So very, very important to make your mind up from the beginning. And then once you do that, you're able to count the costs, like, okay, if I do this and do this, if I'm able to save all this money up, if I'm able to get assistance from this, whatever, I would be able to, afford this long term. I would be able to, put these resources down, make this time out here and there to be able to do this. Then I think that's the most important thing. You're ready to go. And then generally just register for the exams with the CFMG. You schedule your step 1 and step 2, take the exams. You take the OET as well. Dr. Osinusi mentioned IELTS, and for the USMLE, it is OET that you do instead of IELTS. There used to be step 2 CS, which I think would be akin to the PLAB 2, which is like OSCE and stuff like that, but they scrapped that since COVID, and they haven't brought it back. So thankfully, hopefully they never bring it back. Yeah. Then you take the OET, you apply for ECFMG certification based off whatever pathway you choose, or whatever pathway is applicable for you. For example, if you don't have a full license, if you have just a provisional license, there's a pathway for that. If you have a full license, there's a pathway for that. If your school is, affiliated with some certain organization, there's a pathway for that, etc. So you just pick whatever pathway and then you apply based on that. You register with the AMC and ERAS. So that is when you have, by that time, you're ECFMG certified. And ECFMG, sorry, let me bring down some of all these things so that you all know. The match is pretty much the day that everybody knows what residency program they're going to. And it's a lot of things that lead up to the match. But the match is what most people see on Twitter. Everybody's like, oh, I matched. Matching is just saying that you have been, if you found a residency program that likes you, you also like them too, and then both of you match. It's just like the technology was actually the same technology that they use in dating apps where people, match with other people. So basically you find a love partner in a program and you'll match. And then the ECFMG is the Educational Commission for Foreign Medical Graduates. That is the body that helps to certify foreign medical graduates to say, okay, you're up to standard, at least at the same level with the USMDs, and you can take the same exams the USMDs are taking. You can join the same residency programs that the USMDs are joining. And yeah, so once you apply to the programs, you interview and then you rank your programs, and then come March, you match. And I'm running through this very briefly because that's not the essence of what I'm here to talk about. I'm here to talk about the exams. So I just wanted to at least give a broad overview of what the process is before I talk about the exams. And the other things I wanted to mention, which are things that people have matched without, but some people would also like to see that in your application. It gives you, more, you can apply to more programs if you have those things, or it gives you a better chance at matching. But without doubt, there are people that have matched without these things, and that is US clinical experience and letters of recommendation. US clinical experience, honestly, as a medical student, that would probably be better because you don't have to think about things like liability insurance, which will cost money, or finding, it's much easier to find programs or hospitals or universities that would take you in as a medical student to rotate with them compared to when you're an adult. When you're not an adult, when you're a graduate. When you're a graduate, most of all those programs, you're not eligible for them. That's one. And then number two, you probably just get an observership compared to what you would get as a medical student, which will most likely be like an elective or rotation. You will just be getting an observership. And to be honest, if all you have is an observership, you can still match. If you don't even have an observership, people have matched without observerships. So it is still very possible for you to match. But if you have some of these things, it will be better. And as medical students, you might be in a better place to get some of these things done. You just need to give yourself about 1 year-ish. You can still, all of these, I'm just telling you what the ideal situation is, but many of these things have gone through for people without, the seemingly ideal situation. So give yourself about 1 year to look for some of these places that offer these electives. You can email them, you can apply. Some of them will have formal application websites. You can email them, you can apply. If you know any doctor in the US, you could, just send them an email like, hey, I'm a medical student in Nigeria and I'm looking to do this, looking to do that. Would you be able to, precept me, or can I come? All of that. There are also some people that actually do this. There are companies that provide these experiences for medical students. You have to pay for that, so that's adding to the cost. But if money is not your problem, then you can go ahead to look for these companies and get some of those electives. So that's that about US clinical experience. The other thing I would say is also the research. If you have the opportunity to get your hands on any type of research, by all means do so. for me, when I applied, I couldn't put any of the, this is subjective. I probably could have put them in, but they were not published yet. So all the research we did in obstetrics and gynecology, community medicine, I could have probably put them in, but I didn't know how well I'll be able to put them in, because they were asking for like citations and like the links to the publications, and they were not published at that time, so I couldn't put them in. But I believe there's a way to be able to put them in. If you can put them in, that's fine. At least by the time you're graduating, you have research from O&G, you have research from community medicine, so that's good for a CV. If not, you could also just, anything you can, any way you can, if you know any lecturers that are doing any form of research, you could just let them know, like, please do help me. Let me help you so you can help me put my name on the paper. And when they get it published, at least you have a paper to yourself, and something you can put in your application. So I just wanted to mention that. And then the other one was step 3. You do not need to take step 3 before matching. Step 3, I haven't taken step 3. So step 3, you have until like, I think the end of first year of residency to take step 3. So you don't have to take step 3 before matching. But as IMGs, some people consider it, an added bonus, for your application, because many of the programs that see that you've taken step 3, they know that during your first year, you're not going to take time out to go study for step 3 or to take step 3, things like that. So it could also be an added advantage if you can take step 3 as well. Okay, thank you. All right, so I just finished with that first slide, the road to the match. Now I'll talk about step 1. So step 1 basically is basic medical sciences. So when we're talking about step 1, we're talking about 300, the first MB and your second MB. So the MB you take in UO, which is anatomy, physiology, biochemistry, as well as the one you take your first year in Obumasho, which is pathology, pharmacology. Yes. Step one used to be a menace before. People used to be very scared of step 1 because it used to be like the cutoff. Many programs would just filter off people based off of step 1 score. So even if everything else on your CV looks great and your step 1 score is shabby, you've already been filtered off based off your step 1 score. So a lot of people, it used to be, a very, very huge deal before. And so most of the resources you find on the internet to date will be talking about step 1 because it used to be a big deal. But recently they transitioned step 1 from being a scored exam to being pass-fail, which is very great. So, I mean, it's still a big deal now, especially if you have passed it on one sitting, like you didn't have to resit the exam or anything. So in that sense, it's still a big deal, but more of the emphasis has now been placed on step 2, but we'll get to step 2. Yeah, so like I said, step 1 is now pass-fail. Some of the resources that you can use for step 1. And later on, I'll get to what you can start doing from now. But some of the resources, the 2 most important resources will be one question bank and first aid. The question bank, most people use UWorld because pretty much UWorld, they get the questions and they remove early from actual exam questions. So those are, so it's very, very high yield in short. And then MBME. So MBMEs are the exams from the people that write the USMLE themselves. They put out some old questions and some questions like that. They put them out, so you can pay for those ones as well. But primarily, if you ask anybody, like, what can I use for step 1, you're going to hear about UWorld and you're going to hear about first aid. First aid is just a huge book and it's like high yield of the most high yield. It's very concentrated. It's a huge textbook, but it's very, very concentrated to the point where if you're an underliner, you pretty much be underlining almost every line because they have concised and like compressed all the information into that little book. So it is very important. First aid is very important. Some people prefer some other resources like Kaplan, Pathomas, Ketchy, Dirty Medicine, New World RX boards and beyond. So those are others, and this list is not exhaustive. I'm sure there are other resources that other people use, so you can possibly just Google search and look for other people that are using. But I would say, if you could ask me what to recommend, the only ones I used UWorld, I used First Aid, I used Ketchy, and I use Dirty Medicine. Dirty Medicine is just a YouTube channel, very excellent. As a medical student in Nigeria, it might not be as useful because he's just talking about the high yield things, like what they will ask you on exam, and then he gives a lot of mnemonics or like scenarios that he uses to remember some of the answers. But because his content is very tailored to USMLE, it might not be beneficial to you as a medical student now, but it's still something, you know, you can like try to use. If you're reading something on first aid and it's just not entering, or you have tried to cram it, it's not crammable, you can check if Dirty Medicine has a video on that. And you know, he usually gives a lot of mnemonics and stuff like that, so it's real good. And then there is, okay, sorry, 1 second, please. Apologies. Sorry, that was an update from your academic director. Okay, so I was saying, yeah, so if I could advise any resources you could start using, I would say you can start with UWorld if you can. So UWorld is subscription basis, so you can do 3 months, you can do 6 months, but it's also expensive. So that's, if you're not really sure whether you want to do first aid or not, USMLE or not, I think you can start with first aid. First aid, you can use it while you're studying, you know, with your regular textbooks, studying whatever you're studying, you could use first aid alongside. So at least you're picking up on some of the things that you're expected to know, at least from a USMLE perspective. I would say use first aid. And then Sketchy. Sketchy, I don't know if some of you already use Sketchy, but I found out about Sketchy, I think it was 400 level before like microbiology block 2 exam. And I was like, where have you been all my life? It was the night before we were supposed to do systemic mycosis. The next day, myself and one of my friends, we watched all the videos on systemic mycosis that night. And I kid you not, the next day, the first like 15 questions were systemic mycosis, and I could answer all of them. I was like, where have you been all my life? So that's for the old Sketchy videos. So if you have access to any of the old Sketchy videos, I would suggest you can start, at least for those of you that are studying Path and Farm, you can still use. But Sketchy also has like Sketchy pharmacology, the Sketchy microbiology, and I think they have Sketchy for some other topics. But for microbiology, if pictorial things can help you learn, then I think, so Sketchy is not on YouTube, it's a subscription. But somehow, somebody showed me Sketchy when I was in medical school. So you can ask any of your classmates if they have it. But it's actually a subscription platform. You can just Google Sketchy Medicine. But I think somebody had it when I was there, and I was like, at that time I didn't even know what it was. I just saw that there were videos that were teaching things, and then later I found out that it was subscription basis anyway. But yeah, if you can use Sketchy, I think it will help a lot. But if you don't have Sketchy too, that's fine. This is just a personal experience. Sketchy changed my life, so I just had to mention that. Yes, so I would say first aid, Sketchy. If you can afford to get the UO subscription, by all means, you can start using it now. If not, you could just wait till when you're more serious about your exams and start taking the questions. Yeah. Now, step 2. So step 2, oh yeah, step 1 is 8 hours. It's an 8-hour exam. Step 2 is 9 hours. I think you get 1 hour break each for each of the papers, but that's all you get. It's like 7 blocks each. For 7 blocks for step 1, and it's like 1 hour per block, and then it's, I think, 50 questions for the block. So it's, you don't have a lot of time. So you have to like, the point of reading for step 3 is to know and I'll get to this at some point, there are some things that are like really rare facts that are associated with certain diagnoses or certain diseases that once you start seeing in the clinical vignettes, once you start seeing like they're talking about this, they mentioned this, you already know your answer. You understand? So if you're able to study like very strategically, you won't have to spend as much time with the questions. But anyway, 8 hours. So please, next slide. Next slide, please. Oh, step 2. Okay, thank you. So step 2 is clinical knowledge. So that's more what we're familiar with. Internal medicine, pediatrics, surgery, O&G, biostatistics. Biostatistics raises its ugly head in all the exams. So you're going to have to, if you don't love it now, you're going to have to find a way to love it, or at least be able to find a way to work with it. It's a 9-hour exam as well. And this one, like I mentioned, step 1 was not scored, but now step 2 is scored. So you have to keep that in mind. More emphasis is placed on step 2 now. So that's another thing you have to remember. Resources. So for step 2, the resources get trimmed down a lot more, especially because before there was not much emphasis on step 2. It was mainly step 1. So there are a lot of resources for step 1. Now that step 2 is the scored one, maybe we'll start seeing some other resources rolling out, but to be honest, it's just UWorld that most people will say, like, do all the UWorld questions and you'll be good. Other things, you can still consult your first aid. There's a podcast called Divine Intervention Podcast. You can use that as well. And then you can do the NPMs as well. Next slide, please. Yeah, so I thought to note some of the differences between at least what we're used to as medical students in Nigeria versus what the USMLE questions, look like. First of all, there's no negative marking, so you can breathe. You don't need to think about all that negative marking, minus 0.5, minus minus 0.25, forget about that. There's no negative marking. Everything is multiple choice questions, so there's no true, false, true, false, true, false, true, 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 whatever. That's not there. And then the second thing is 50% is not passed. So I know you're thinking about, like, in school, most of us were like, God, please, God, I beg, God, please, if you can just get me to 50%, let me pass. That was me in anatomy. Let me just pass and go. 50% is not passed. I think the pass mark for step 1 is somewhere in the 6, it's like 196 or something, and that's somewhere in the 60% range. But if, for example, for an exam like step 2, if you're going to be scoring the barest minimum, like I mentioned, it's many programs would use that to filter off. So if you're going to score the minimum, which is 60%, then most programs would have already filtered you off. So a reorientation, when you're doing questions, a reorientation you have to have is, it's not just enough for you to be getting 60%, whatever. You have to aim for like 70%, 80%. In the beginning, it's probably not, in the beginning, you would see a lot of, 30s, 40s, 50s, because we're just not being trained, to answer questions like that, but it's fine. Eventually, just hope to get some of the higher numbers, especially for step 2. Step 1, since it's pass fail, as long as you're still in the passing percentile, you're good. The other thing is give yourself some grace. The USMDs, they're being taught to write their exams like this. The same way they might not find it easy if they come here and they're having to write theory questions. They're having to, the way we write the theory questions, and there has to be introduction, outline, introduction, the body, and then whatever. The prep is the same thing. So they probably also will be like, what's going on here? They probably won't be able to answer questions that same way. Or OSCE, Viva, they're not used to things like that. They're used to OSCE, apologies, but I meant Viva. So give yourself some grace. They focus a lot on the rare conditions and the rare facts. So there's some diseases that the first time I read about them was when I was studying for step 1, because we're not focusing on many of those things as in medical school in Nigeria. They want you to know, to be a well-rounded doctor, to be able to know how to attend to all these different things, but they're not focusing on like the rare associations with certain diseases. So there's that. I used to tell people, I failed a malaria question on UWorld, and I was like, no, this is not the malaria that they taught me in school. No, because they looked for like one random presentation of malaria. I'm like, this is not malaria. Anyway, so they just look for like the rare conditions and the rare facts, and they major in all those things. That's why those resources that I say they have all the high yield facts, they are looking for like those high yield associations with those diseases. And then, yes, less emphasis on basic sciences. That's for us. In Nigeria, there's somewhat a lesser emphasis on basic sciences compared to the clinicals. At least most of us, we got more intense training with the clinicals compared to what we got in the WHO. But step 1 is very, very heavy on this on basic sciences. Even going into step 2, there are still some things that you bring from step 1 that are also very basic science oriented. So you need to know all of that. And then I'm trying to wrap this up, guys. I'm sorry. And then the other thing is, when you're answering questions, you have to look at why is this the answer, and why are the other options not the answer, whether you get it right or wrong. because that's very important. Your world is a question bank, but it also has a after you answer the questions, there's a brief part on the bottom that gives a brief overview of the topic, and then they go on to tell you why this is the answer, why it's not the answer, why the other options are not the answer. So it's very important to go through all of that, because it will show, especially there are some diseases that they will mimic each other, but at least with those answers you can see what the rationale of the examiners is, something like that. Next slide, please. And then my last slide. So what can you start doing now? Like I mentioned, if you can get access to Sketchy or any of those resources, to be honest, let me not just say Sketchy because I'm just biased towards Sketchy. Then you can, if you want to start doing questions, if you think you'll be able to add it to your schedule, you can. Disclaimer, when I was in medical school, I knew I was going to do USMLE earlier on, but by the time I figured, it was like, am I going to fail medical school because I want to start writing UWorld? Because USM, because I realized it is very, very, very it needs your time, it needs your attention and all of that. And I was like, at this point, I'm begging God to help me with BUTH exams. So at that point, I was like, okay, let me just, after graduation, I'll focus on UWorld. So at that time I had first aid, but I just didn't even touch it or use it or anything. But if you think that is something and that was like towards the end of 400 level pattern farm. If I had made up my mind at the beginning of pattern farm, I would have probably started using some of these resources, but I just delayed. And then by the time I was ready to start using the resources, I was like, So if you're 400 level at the beginning of pattern farm, best time. That's the best time to start. But I mean, if you don't have that time, then any time is always the best time. Your best time is now. So if you think you can start doing Sketchy, if you think you can start doing first aid now, or any of the questions, I'll say go ahead. But I would also like to say it is very, very important that you do not let your regular school academic stuff lag in any way, because what will it profit you if you pass step one, but you're having receipts, and then you probably don't graduate with your classmates, and then it shows up on your transcripts. You have to submit your transcript to apply for the match, but I haven't really seen any emphasis placed on transcripts as much. But it's just the overall sense of it, like you won't be able to graduate if you don't pass your regular medical school exams. You won't be the best doctor you can be if you're not sound as a medical student in the home that your home institution where you're being trained. So I'll say weigh all of them together and see what you can do and how you can implement it. If it's that you just do a couple questions a day, if it's that you would maybe just read on a topic before you go for lectures, at least read on the USMLE part of the topic or watch a video on the topic before you have the lecture. So at least when you're having the lecture, it's like you're hearing it for the second time and you already know what the USMLE people are looking out for. So I'll say do that. If you think flashcards would work for you, I tried flashcards, but it wasn't just my jam. So if you think flashcards would work for you, then please, by all means, you can start using flashcards now. And flashcards would be, I'm sorry. I'm wrapping up. But flashcards, many people do a lot of flashcards, at least in the US system, they use flashcards to learn. The whole thing is to, inculcate active learning skills. So using questions, using flashcards, things that would, it's not just that you're writing, you will write from Sembu, you will write it into your Jota, from your Jota, you write it into another place. So you're trying to see how much of that information that you're able to retain to either flashcards or questions. So if we can start doing that now, then when it's time for you to at least, take more dedicated time to study for USMLE, it's more a habit, it's more of a habit to you. Yeah, the only other thing I'll say would be to research about the exams. Don't just take everything I'm saying. Watch videos, watch YouTube videos, read articles online, read people's blog posts, and read other people's opinions, hear from other people, and see if you find anything else that will work for you. Then, like I mentioned, if you can get USC, get USC, and if you can do research, do research. Yeah, that's pretty much the end of my slide. Also, like Dr. Osinusi, Dr. Emmanuel said, please hold God to your chest, because there's so many things, there's so many days that you would probably, you're just tired. But if you have God, at least you have that at least if you have faith in God, then you have that as a source of support and strength for you. There are some other people that I think are really interesting that you guys can decide to follow. There's somebody I know that took his step one in I think he's from UCH, and he took his while he was still a medical student. So if you don't mind sending them messages on LinkedIn, if you're that type of person, there is Hillary. I'm just gonna type that because that's a long name. And then there's Miracle Eke. I think she did her medical school in Ukraine or something, but she's matched as well. So if you guys think you also want to get other people's opinions, I'm gonna put their names in here. You can check for them on. I think the Dr. Hillary, he had a Medium post about how he was able to do it. He didn't really specify like how he was able to juggle both, but if you think you can reach out to him to get some more information, that would be great as well. I'm just going to type them in here. Yes, and I'm sorry, I probably went like 5 minutes over. I'm so sorry, but that's all I have to say. Thank you.
Thank you very much, Dr. Oluchi. Thank you very much. Thanks for your time. Really appreciate. Seems like we have lots of questions for you. People have been sending me questions, so I will just go directly into it. I think the first and the most important question for me here is that how many years have you spent in?
How many years? What?
Okay, let me just read it the way the person sent it. I beg, how many years she don't spend for US? We are sent sweet like this. So I think it's very, very important. We actually know that, you know. So we want to know that so that we thank you. That's number one. Do you want to answer that question?
Do I want to answer the question
Yeah.
about the accent or how many years?
No. About the accent. How many years do we have to spend?
I can't answer that question. I mean, I don't know.
Just pulling your legs. So this is
I
this is
know.
this is, this is the next question. After writing Plab 2, can you go straight in? No, sorry. I read you wrong. Please, can you help me ask if someone can match into public health or community medicine in the US?
Yes, there's actually a residency called preventive medicine. So if that's your jam, if you want to do that, you can. Oh yeah, there was something else I was going to mention. Sorry, I just put the names of the two people. There's Miracle AK, and then there's Hillary Alemenzolu. I'm sorry, I don't know where he's from. If you know where he's from and I butchered that name, I apologize. So yeah, I mentioned that. But sorry, the question was something. I was going to answer that question before I mentioned that. What was the question? I'm sorry.
Okay, can you help if someone can match in public
Yes,
health?
yes. Thank you. Yes, so there's a residency program. There's a residency part. There's a specialty called preventive medicine. That's what I meant to say. And the other thing I was going to mention before I mentioned that I put those people's names in there is that you could also decide to do an MPH in the US. That would help you, at least, first of all, to get in the US. Second of all, when you're in the US, you can take the exams. Because in Nigeria, we don't have a testing center. You have to go all the way to Ghana. So if you're in the US, at least you'll be able to take the exams. Second, you'll be able to, if you have an MPH, at least all the time you're in the US, you can use to take the exams, you can use to get some US clinical experience. So, and then, I mean, an extra degree doesn't really hurt people, does it? So if you think you, at least you, and I'm seeing a lot of things here, but my point is, I think it's much easier to get in the US to get an MPH, at least for starters, and then, or any other form of master's degree. I know there are a lot of people that go on scholarship basis, so you can explore that too, by all means. Yeah.
Thank you.
Yeah.
Another question. When do you suggest one starts to write the exam? After
When do I
medical,
suggest?
a year after house job, or that's one. Then how long does the ECFMG certificate of participation last for once it has been acquired?
Okay. How long? When do I think you should start taking the exams? Honestly, that's a very personal question. Look at yourself. Look at this condition you are in. This Mr. Dr. Hillary, I think he took his in like 500 level. his step one, he took it in like 500 levels. 500 levels. So if you think at the point where you are, you can, juggle studying for another exam while at the same time, doing medical school subjects, that's fine. If you're in 400 level, I would say like 400 level that you just started doing like part and farm stuff like that. I would say that's the best time, start using some of these resources. So at least you are, focus on that. You could also decide to take step 2 before you take step 1. Step 2 is clinical knowledge. So if after graduation you feel like you're in a better position to take it, but I would advise you take some step 1 because some of it is a rollover from step 1. There are some questions that they will ask you in step 2 that if you had this step 1, basically the questions and you're like, okay, this step 2, I can do it straight out of graduation, you can do it. But it's a very personal question. I can't really give a blanket answer on when to start. Some other people would decide to go to the UK first, do PLAB, go to the UK. While they're in the UK, they start, the USMLE pathway. At least by that time, you're earning some money, you can pay for the exams. You have, a little bit of time on your side, you can take the exam, stuff like that. Some other people, they decide to take it when they're in NYSC. Some people decide to take it when they're in house job. So I think start studying. And when you start studying, you see, how long it's taking you to assimilate some things. You see, how you're performing on some of the tests, on some of the questions. And then by then you'll be able to project that, okay, this is something I can do, while still in medical school. This is something that if I give myself 3 months or 1 year, in the NYSC, I can be able to do things like that. So that would be my best answer for that question. And the other question was about ECFMG certification, how long it lasts. Sorry, I'm having difficulty on answering this question because prior to that, there was a certain duration of how long it could last. And then was last year or so, they had said it was going to expire at December. It was going to last only like 1 year and expire December this year. And then after a while, I got an email saying my ECFMG certificate is indefinite now. So I really can't answer that question. I think just go to the website and see what the latest, what they're saying for now. Yes.
Okay,
Sorry.
okay, thank you very much.
Yes,
We
sir.
have one more question. We have another question from Tolani. Tolani, do you mind asking your questions, please? Thank you.
Good evening. Thank you so much for your presentation. Okay, so I have 2 questions. The first question is talking about the USMLE route. I've asked some people and then they said they would advise to go the PLAB way first and then from the UK you should write your USMLE. I don't know if you would advise that or how feasible it is. Then
Yeah,
the
I just
second,
mentioned.
okay. I'm sorry.
Continue.
Then your second question is, how feasible is it to enter for surgical programs using the USMLE? Because the information we have is that they don't really give the surgery matching to third world countries like Nigeria. So,
Okay, so I have to answer these questions now very fast. First of all, I already mentioned if you can go PLAB way first and then write the USMLE because it will help you. At least you're saving some money. You can use that money you're earning to pay for the exams. You can have some time to write the exams. Then you've already taken a similar exam in the past, so you have an idea of what's, at least some of the things you've taken them recently, so you are more refreshed about some of those things. So for many people, that is the best and that's the most feasible route. And at the same time, if you've tried to take the USMLE and it doesn't work out, at least you already have a cushion to fall back on. You can continue with your UK, journey if you don't want to do that anymore. So that's that on that. Please, if you need any more clarification, let me know, but I'm trying to answer them fast. Then the second would be, second question was about how likely to get into surgical specialties. First of all, nothing is impossible. There are Nigerian IMGs that have matched into surgical specialties, so it's very possible. But it just means that you have to like your CV, your scores, everything else. You have to have some clinical experience. You just have to, like, there's some more things that you have to put into your resume that other people will be interested in, sending you interviews for. So yeah, you have to have like one of the best scores. You probably need to know some people, maybe go rotate at one of those one of those residency programs where they take surgery interns, so that at least by the time you get there, they know you. By the time you send your application, you'll be like, hey, please, I sent my application, could you, look out for me, things like that. Network a lot, so that at least there are other people that know you. Research, like very heavy on research, have a lot of research. Yeah, so that's pretty much what I'll say. And then of course, favor and grace.
Thank you very much. We have more.
Mm-hmm.
Um,
Mm-hmm.
Next question is, it says, this is a good day. Thank you for the presentation. What's the pass rate for people of color? And second question, how long do I need to study for to be assured of passing the exam at once?
So how long you need to study for? I'll start with that. It's a very subjective thing, because by the time you start studying, based off the time that you have at your disposal, for example, if you're doing house job, you probably don't have as much time compared to when you're in NYSC. So based off the time you have, you'll be able to probably achieve more in studying, compared to, if you're doing house job. So I would say most people would say anywhere from 6 months to 1 year, but some people have done it in less than 6 months, and some people have taken more than 2 years to study. But just know that the longer it takes for you to study for the exams, the more you are forgetting many of the high yield stuff. So 6 months to 1 year, I think, is a real good sweet spot. And then people of color. So the beautiful thing about the USMLE is that it's a level playing field. Like, as long as you've been able to show them that you went to a medical school, everybody is taking the same exam. So you're taking the same exams that US medical students are taking. So as long as you have the resources that they also have, like, it's not anything about your skin. Now, if you're talking about matching, there are some programs that, even regardless of your scores, all they want are USMDs. But then there are some programs that all their residents are foreign medical graduates. So there's opportunity for everyone. Probably more opportunities for USMDs to match compared to IMGs, but every year the rate of IMGs matching is increasing. So it's not really something you should be scared about. But as per taking the exams, everybody's on the same level. As long as you have a brain, you can study, you can pass.
Okay, thank you.
Okay.
Thank you. Then the last question, the last set of questions for oncology. What do you advise I do? Okay, for oncology, what do you advise? I do my, sorry, the question is not clear. Let me start with another one. Can one retake step one if they don't get the cutoff? That's one. Can one take step two before taking step one? Or does it have to be chronological? Then
I already
that's
said you can take step 2 before step 1. So however you want to take it, but most people usually take step 1 before step 2. And I already mentioned that some of the things they will assess you on step 2. If you had step 1, at least you have some of that knowledge, so it will be easier. But if you want to take step 2 first, that's fine. And then the first question was, I'm sorry, what was the first question? Something about oncology.
the first question is,
Yeah.
can one take step one if they don't get the cutoff?
Oh yeah. Can you take step 1? So yes, you can. But then for if you don't pass the first time, it is on your transcript. It's on the transcript that's getting sent to programs. So some programs also just automatically filter off applicants based on if it was their first, if they passed the exams on their first try or second try. So everybody's advice is take it when you're ready, because if you fail, you still have, and you have a lot more things to deal with. The decreased morale of not passing, then you have to take the exam again, and then when you're applying to programs, you're wondering if all the programs have filter you off based on that. So the advice is always to do it the first time and pass. If you need to shift your exam or reschedule it or whatever, that's fine. But do it when you are ready and then pass.
Okay, Shonaike, can you please ask your question? Then Fadi next, and that'll be the end.
Okay, thank you, Dr. Mosario, for the presentation. Regarding the oncology question, I want to ask if where do you advise I do my residency in? Because oncology is broad, and I've been conflicted because I know that ONG has oncology, hematology has oncology, and like most of the specialties have oncology. So is there like a oncology, or do I have to go through internal medicine or surgery or something? Yeah, that's my
Okay,
question.
thank you. So there are different types of oncology. There's medical oncology, there's surgical oncology, and then there's rad onc, so that's radiology oncology. So depending on what you want to do, you would pursue training in either of those ones. If you're talking about the US, if you want to do medical oncology, then you have to do internal medicine 3 years first, and then do a fellowship in. If you want to do hematology and oncology combined, that's 3 years. But there are some few programs that have oncology separate for just 2 years. So after internal medicine, you do that. So that's about medical oncology. But if you want to do surgical oncology, I think you have to do general surgery first. Don't quote me on that, but you could do some research. And then for radiology oncology, you can go, I think you just do like a 1 year transitional year, which is just like internship, and then you proceed to do the radiology oncology. So depending on where your interests are you thinking of, killing cancer with radiology or surgery or, medicine, then you find your pathway. So that's based off the US answer. Maybe Dr. Osinusi can clarify about the UK pathways, because I don't know how they do it in the UK. But that's how it is in the US.
Okay, so for the final question, Fadira, you say you have a question. Can you please go?
Okay, thank you so much for your presentation. I actually have two questions. The first one is how is matching into cardiology like do you have any advice for people that are interested in matching into cardiology? And then my second question is that that is from what I know, the matching is like a yearly thing. So if one doesn't get in this year, you have to wait like the next year. Would that also be on like your record, like a transcript that will now like, make where you want to match into filter you out because you want like match the previous year and the next year, then like you filter you out in some sort of way? That is my second question. Thank you.
Okay. So first question, cardiology. For cardiology,
Sorry,
um,
sorry. Before you answer, I just want to add the last one. I just saw it, and this will be the final one, so that you just answer the three and we can call it. So it says, "I thank you. Please, do we have to take our job here in Nigeria to get matched in residency and move there to work?"
Okay. Yes, sir. Cardiology in the US, you have to do internal medicine first before you do cardiology. And I'll just mention the other things you have to do internal medicine first for. You have to do internal medicine first for cardiology, hemonc, endocrinology, nephrology, critical care, that's ICU stuff, pulmonology, infectious diseases, things like that. You have to do internal medicine 3 years, and then you do the other 2 years or however long for the other fellowships. So they are called fellowships after residency. The second question is, if you didn't match this year, would it show on your CV the next year? No, they don't know. It's the match is not, it's just the exams that it will show, like how many attempts you've had, but other than that, it doesn't show. And then house job, if you want to do house job, go ahead to do house job. If you don't do house job, they don't care about it, as long as you still have a provisional license from your country. And that is what they give us at graduation. You get a provisional license before house job, so you can go ahead to do that, but you don't need to have house job to be able to match. I think that's all, right? Is that all?
Yeah, I think that's all. I think that's all.
Okay.
Thank you very much, Dr. Muturayo.
My
And
pleasure.
on behalf of everyone, I say thank you again. And I think everybody can actually say thank you by themselves. You can unmute yourself and say thank you to Dr. Muturayo.
Thank you, ma.
Thank you, Dr.
Thank you,
Ubi ma.
ma.
Mutfwani.
Thank you, ma.
Ubi ma.
Thank you. Thank you,
Okay,
Thank
so
you.
Thank you, Dr. Mutfwani.
before
My
Thank
pleasure.
you.
before we end, I think Dr. Oshinusi is still on the call. You can unmute yourself, Dr. Oshinusi, and so that you can just give us a closing, remark to, so that then we'll round it up.
Okay. Okay.
Give us a vote of thanks. Let me text the
A vote
prayer.
of a vote of thanks. All right. So
It's
thank
not the one that's
you.
supposed to do thank you now.
Can you hear me? Hello.
We can
Yes,
Hello.
I
hear
can hear
you.
you.
Okay.
Yes, we can. We can.
But I know it cannot be my network. I can come. I'm just joking. Anyways, Thank you, Dr. Motora, for coming for that insightful talk on the US pathway. I think it's a gold mine because if you look at how much you earn, if you're somebody who is if you're looking after money, like that's your aim, you earn a lot of money there. But aside from that, the medicine you practice outside is actually good. And I will just round up by saying this. Also, thank you, Victor. Thank you, everyone, for coming for this session. Follow your heart, follow God, right? It's not everyone that jackpots that ends up being happy. Sometimes you may be happier in Nigeria, no matter how things are looking. I mean, people are saying T-Pain. I met somebody else that was bringing me up to speed with the meaning of T-Pain and our guy. I've been out of Twitter for a while. But follow God. I just want to let you know that if you decide to travel, right, the medicine you would see is actually medicine in the sense that you're not just looking at theory. Like if you want to order for a test, CT scans, MRI, stuff like that, it's done easily. It's not a problem. And then you have people that will teach you. So you practice the medicine itself. At the same time, ask yourself what you want to do long term, right? And like I said, follow God. Lastly, I'll advise you anyways, I'll leave that for another time. But follow God. If you want to leave, start practicing, start early, start working towards it. The earlier you leave, the better for you. And if you are listening here, you're already practicing, you have some years of experience, you can still live and transfer those years of experience when you practice. As a matter of fact, it's set to be a bit easier to get jobs now in the UK if you have some years of experience because the junior grade jobs, ST1, ST2 jobs it's a bit difficult to get it now because a lot of people are applying into those pathways. But never believe it's impossible. Never believe it's difficult. You can do it. All you need to do is to sit down and write. And very importantly, know your strength. Financially, know your strength cerebrally, in quotes. But at the same time, cerebrally or not, you can write both exams and you can pass, and you can pass well and can get matched to whatever specialty you want to do. For guys that want to do surgery, I will advise that you look up, if you want to come to the UK, look up person specification to get into training for surgery or whatever specialty. Start working on those things now. If you need to attend conferences, you need to attend seminars in quotes, attend all of that. Record yourself there. Take pictures. Get stuff signed off and put it into a small folder. They will be very helpful for you when you start applying to those rules. I wish everybody all the best. Please and please, it's important to hold God, not just for medical school, but for this journey in terms of leaving the country if that's what you want to do, and even staying. Because I don't think you have choice if you're staying in Nigeria and you don't want to hold God. It's not you have choice. But even if you want to travel or you're staying, hold God, hold him very tight. It will make things a lot easier for you. Thank you guys for having me. Thank you, Dr. Motorayo. Thank you, Victor. I wish you guys all the best. If you have any questions, Victor has my number. You can send me a DM at any time. My WhatsApp is a mess, to be honest, because I have DMs from so many people. But you can call me. If you send a DM, I don't respond, please call me, and then I'll try to call back. Take care, everyone, and see you guys soon.
Okay, thank you very much. Thank you very much, Dr. Osinusi. Thank you very much, Dr. Motorayo. We really enjoyed this session. It was lovely and we learned a lot. We learned a whole lot. We really appreciate. Also, I want to say thank you to everyone that attended this meeting, Bowe night and non-Bowe night. Thank you for attending. I hope we actually learned a lot. And finally, I want to mention the fact that this meeting has been recorded, so we would upload it soon. So if you missed the part of it, if and the slides will be sent to our group chat too. So if you missed the part of it, you can actually go online and check for the meeting. So thank you very much. Thank you once again, Dr. Osinusi. Thank you once again, Dr. Muturayo. Thanks for your time. And Dr. Osinusi, very soon our lives too will be 24/7. Because
Amen. Oh.
you are flexing on us too much. I will be there very soon. I don't know about the others. So you have, and our network, my network too, will stop, hanging very soon. So that will be all for now. That will be all. Uh, I think Victoria, can you please give us a word of prayer? So let's end with a word of prayer, Victoria. Thank you.
This is Victoria's time.
Okay, if Victoria is not there, anybody there can actually give us a word of prayer if you don't mind.
Oh, I'm here. Oh, I just
Okay,
wanted to be sure I was the only
okay, thank
Victoria
you.
here.
Is your Victoria? Thank you.
Okay. Father, we thank you for today. We thank you for the opportunity you've given us. Thank you because you've given us the grace to learn a lot from you. And we thank you because of the doctors that you also used for us to teach us the way to make our lives better as we plan for our future. Father, we pray that you help them wherever they are. We pray that you keep lifting them up. We pray that you keep guiding their steps. I'll pray for every one of us that is making plans to travel. We pray that you give us the strength that we need to prepare to write the exams in Jesus' name. You make all the
Amen.
process free and easy and with ease in Jesus' name.
Amen.
Just name we've prayed.
Amen. Okay, thank you very much. Now we are calling. The meeting is ending now. Thank you very much. Thanks for all joining. So, bye, bye, everyone.